You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new breakthroughs in the treatment of gum disease. According to my first guest, no more bleeding gums, no more bad breath, and no more cutting and stitching surgery. With us, we have an expert on the topic. He is Colorado's dentist, Dr. Twiss. Welcome to the program.
Thank you. Thank you for having me.
Now, before we get into today's topic, and I have a lot of questions, tell me a little bit about your practice. You know, I've been to your website. You do a lot of things. So who's the typical patient? What are the different procedures that you do?
Well, our practice is a general practice. I am a general dentist, and so we see a variety of patients. We do regular crowns and fillings. We do braces at our office. We do cosmetic whitening, veneers, as well as migraine prevention and laser treatment of gum disease.
Now, you have one of those machines that makes the crowns right then and there. It's like having a lab on site. Tell me about that.
Well, the CEREC machine, it uses all porcelain, no metal is involved. It uses kind of the advanced technology where we're able to make the crown in the exact same visit. So you don't have to have a temporary, you don't have to go for a couple of weeks without your tooth, and you don't have a second appointment to get numb a second time.
Now, and I know you have 3 children.
Yes.
Any dentists there? Do they want to be dentists?
I don't know. We'll have yet to see.
They play soccer. I guess you're also a soccer coach.
I am. Yes, I coach my daughter's soccer team, and so I'm active with my kids, active in the community, and you know, things I have a passion for. I love to kind of stick with it.
Okay, good. Now we invite you in the program to talk about laser dentistry in regard to the treatment of gum disease.
Yes.
First, what is gum disease or periodontal disease? Is that the same thing?
For the most part, there are some technical differences in that. Gum disease is kind of a broad term that most of the, I guess, the lay person would understand. The technical or scientific term is periodontitis, and that's more of an advanced stage. The beginning stage that most people hear about, we hear on the commercials on TV, is gingivitis and how to prevent gingivitis, and that is a reversible form of gum disease. Okay, you love this laser, by the way. I don't want to put words in your mouth. Why do you like it so much? It's amazing. So I've been blown away by the results and the type of healing, the changes that I've seen in my patients' lives have been amazing. And before I ever had it, before I knew about it, I would hear other dentists share their stories of patients that had bleeding gums, deep pockets, and after using the laser, they had no more bleeding gums. Their pockets were reversed. And pockets are what? What are pockets? Pockets are basically from the top of the gums down to the bone that surround the teeth and hold the teeth in place. Okay, and so it's bad to have pockets? Yes. Or it's bad to have big pockets? Yes, normal, healthy gums. If you go to the dentist or the hygienist and they measure your gums, they count out these numbers. Yeah. And so good, normal, healthy gums will measure 2 and 3, and those are in millimeters. And that's kind of a standard. So everyone does have pockets. It's deep pockets that you do not want. Now, you're big on technology, you told me on the phone. Yes. Tell me about that. I could say I'm more of a early adopter of technology. We also have intraoral cameras, which are small cameras that we can show inside your mouth so you can see what we're seeing. Okay, good. And when you make crowns, I mean, you have a camera for that too? Yes. So you don't need to fill your mouth with the... Correct. When we make the crowns, we have no impression material, like oopy, gooey stuff that goes in the mouth that most people makes them gag just thinking about it. We don't have any of that for making crowns. So while they're waiting, you can make their teeth? Yes. So while they're waiting, we finish our work. They wait about half an hour, and the crown is completed, made, and ready to insert into their mouth. Okay, so at the top of the show, I said no more bleeding gums, no more bad breath. We're talking about gum disease. For people that don't know, they're watching this, what are the symptoms of periodontal disease? Well, most people will recognize that after we've said what it is. Most people don't even know they have it. It's what I call a silent disease that people can't see, people can't feel, until basically it's too late. All right. So this starts out with bleeding gums, bad breath. But are you supposed to bleed a little bit when you floss? No. Really? No. That's kind of a misconception. If you're using bad technique or you're cutting or ripping the gums, you will get some bleeding. However, in good, normal, healthy gums, there is no bleeding, even
So if
while
you have
flossing.
bleeding gums, what does that mean, by the way?
Bleeding gums means that there is an inflammation or an infection in the gums.
So is that what this is? I mean, gum disease is a bacterial infection
Yes.
under the gum line.
Absolutely.
So other symptoms. I'm sorry I interrupted, by the way.
Yes. Bleeding gums, bad breath, which is an indicator of bacteria. The bacteria.
So the bad breath is caused by what?
The bacteria leaves a smell. That is in the mouth, around the teeth, around the gums, on the tongue. It is a sign that there is bacteria, and it does leave a bad smell.
And you kill it with the laser.
Yes.
I don't want to oversimplify it, but that's what you do.
Yes.
Is that right?
Yes. We go around the mouth, and the laser is actually attracted to color or pigment. And the bacteria has color and pigment in it. And so the laser seeks out that pigment, seeks out the bacteria, and because of the wavelength and the technology behind the laser, it zaps and kills those bugs, the bacteria that causes the gum disease, that causes the bad breath.
Now you say that the laser you have, I guess this is like a $100,000 laser, that not all lasers are created equal.
Right.
What do you mean?
So this laser, specifically in dentistry, is the only FDA-approved laser for the treatment of gum disease with the LANAP protocol.
Okay.
And the LANAP protocol is a patented protocol from Millennium Dental, the makers of this laser, and it is the only one approved for treating gum disease. There are many other imitators or things that may come close to it. However, this is the only one that has the FDA approval.
What is your training with this laser?
Well, before you can even own this laser, the company requires you to have advanced training. So there we have 3 really intense days, 12-hour days of training that we do before we're even allowed to have the laser in our hands to treat patients with the laser.
Do you have patients that have bleeding gums, bad breath, and after you do your treatment, within a week or so, that goes away?
Yes, we do. We have patients. I had a patient a few months ago. He traveled almost an hour and a half to my office to be seen because of the laser. And his wife had complained about his bad breath, and he had gone to another dentist. They told him he needed to have all of his teeth removed and have false teeth put in. He sought me out because he wanted an alternative to losing all his teeth. Okay. Where before, he was relatively young. He was about 45, and he did not want to lose his teeth at such a young age.
So he had a bacterial infection. Is that your stance?
Yes.
So he had gum disease. What were his symptoms?
His symptoms, he had loose teeth, he had bleeding gums, he had bad breath. All of the things that we just talked about are the classic symptoms. And as most males do, they wait until the last minute to get something done.
So his wife made him go to you?
Yes.
You said.
Yeah.
Okay.
His wife said, you need to do something about this. So we see him, assess that right away. We can see on the x-rays the amount of bone loss surrounding the teeth, and we show him what the possibilities of the laser are.
So he was told these teeth have to go?
Yes.
Okay, because of this bacterial infection. You say, no, with a laser.
With the laser, we are able to save most of those teeth.
So what was the treatment like?
Well, he came in, we did the laser treatment on him, and really, within 1 to 2 weeks, his teeth are not loose anymore. The pockets have shrunk and closed together. His gums are not bleeding. And he actually mentions that he feels just a little more energy. He feels better, and not just his gums, but kind of his whole overall health.
So with the treatment of gum disease, we talked about new breakthroughs. So the laser is a new breakthrough. I'd like a comparison of traditional periodontal treatment for gum disease and what you're doing with the laser.
Okay.
And maybe we could even use that guy as an example.
Okay. Well, traditional gum surgery, things that have been done the last 30 years, is you cut the gums, you peel them back away from the teeth.
Okay.
You go in and scrape, clean the teeth, and then fill that in with bone, stitch that back up, and then hope for a good recovery. And Randy, it doesn't have to be like that. It doesn't have to be that way. Like the laser.
So that's one option.
Yes.
Is that an effective option?
It does effectively treat the gum disease.
So you could cut it out.
It cuts away all the unhealthy tissues.
Okay.
But it does not kill the bacteria that caused that in the first place.
Interesting, interesting.
So you can either cut that out, cut the diseased gums away, and you can take care of it that way. The other way is you can actually kill the bacteria without taking away any healthy gum tissue.
Okay. Now, so normally how this is done, you have severe gum disease. I guess a general dentist says you have to see what? The periodontist.
Yes.
Right?
Yes.
Okay. And some periodontists, and I've interviewed a few periodontists, are using the laser. So this is becoming more proven, and there's science behind this.
Absolutely.
What you're saying.
Absolutely. There are many, many studies that are in what we call peer-reviewed journals that other researchers, other dentists look at and approve and go through to say, yes, the proper protocol was followed. And so we have many cases where the proven results are documented, and we actually see bone growth, we see new attachment from the gums to the bone to the teeth that comes back. And this allows your body to naturally heal itself using the body's own elements.
Now, nobody wants to lose their teeth, right?
No,
okay.
Not at all.
But is it true that the gum disease, this bacterial infection under the gum line, is the #1 reason why people lose their teeth?
Yes.
So you can either...
For adults,
okay,
it's the #1 reason for adult tooth loss.
So, and I want to make sure I get this right. You could either cut it out with surgery, or you can laser it out. In a way, you can kill the bacteria.
Yes.
Because logically, it makes sense, you know. And I'm trying not to side with you, but I talked to specialists about this. In fact, one of my friends that teaches at Temple University, where you went, Dr. Stephen Brown, and he says, Randy, it is absolutely. He doesn't do surgery anymore. And he says that periodontists are even divided on whether they want to get the laser or whether they want to stay with the surgery. But he says that the laser, in his opinion, is the most effective.
Yes.
Is that what you find in your practice?
That's absolutely what I find. You know, we can either go from what's been done the last 30 years, where we can look at kind of the future of how we can treat this. And I find that if it has the proven science to back it up, and we see the clinical results affecting people's lives that we actually, in reality and not in a research laboratory, but we can see this affecting people's lives, then it's something that I want for my patients, something I want to be a part of, looking forward.
Other symptoms of gum disease, and we talked on the telephone, puffy red gums.
Yes.
That means you have, that's an infection under there.
Yes, absolutely.
That you can zap out.
Absolutely.
With the laser.
Puffy red gums, bleeding is not normal. So those symptoms indicate that there is something wrong. You may remedy that for a little bit. It may go away for a few weeks or even a few months at a time, but that will come back because it has not completely healed, and the true cause of that has not gone away.
You sent me some materials, and there's like a badge or something that says no cutting.
Yeah,
no
so it's a
stitching.
little symbol that says no cut, no sew, no fear. Most patients are fearful of the traditional way. If they've known someone who's gone through before, the most common thing I hear is that it was painful. I had a horrible recovery. It took 2 weeks, 4 weeks sometimes until I felt back to normal. Yeah. And so that little symbol, no cut, we don't have to take anything and we don't cut your gums. No sew, there's no stitches involved. We don't have to stitch things up, don't have the stitches taken out. And the no fear is, it's a lot less invasive, a lot less pain, and a very quick recovery.
So get rid of the chronic infection. There's a video that we have that you gave us. It has audio as well. So we're going to go to the video.
Okay.
What are we looking at here in this video?
Today we're going to look at, it's an animated video of the process, and it shows what the laser looks like going around the tooth, and how that is actually cleaned up and the diseased tissue is taken away.
Okay, good. Now, if you're just tuning in, we're talking about a new breakthrough option for people with gum disease or periodontal disease. And I guess it could either, this bacterial infection could either be cut out or it could be lasered out. And we're about to take a look at this video. We're going to go to the video.
The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The Periolase laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. These instruments use sound waves to vibrate and break apart the hard mineral calcium deposits, with water flushing away the debris and cooling the instrument tip. Some hand cleaning instruments may be used at this time to remove any remaining hard calcium deposits. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.
It looks pretty simple.
Yes.
I mean, is it tough to do, by the way? And could you burn the surrounding tissue?
With this laser, it is very, very hard to really have anything go wrong.
Okay.
The safety net involved, and with the technology behind the laser, we do not see burned gums. We do not see anything except great results for the patients.
Now, do you think the future of dentistry is that maybe 10 years, 20 years, or who knows, where you go around the mouth with a laser?
I do.
Really?
I think that...
Because everybody has a little bit of gum disease, maybe if you're over 40?
Absolutely. You know, 85% of Americans have some form of gum disease.
A bacterial infection of the gum.
A bacterial infection, whether that's the beginning stages all the way to the most severe. And so 50% of Americans have moderate to severe gum disease. And so it's very widespread. And the laser, I think, is the future of preventing that, and also not curing it, but getting it to a manageable state where we can prevent a lot of tooth loss.
Okay, so you're also doing a combination of therapy.
Yes.
Is that right? Tell me about that.
Well, we use another product, another source of treatment besides the laser, and that's called Periodontal. It's a set of trays that you wear to basically kind of flush out that bacteria that we talked about that causes those red, bleeding, swollen gums. And the Periodontal trays have a medicine that you put inside, you fit them in, similar like you would.
It's not antibiotics, though.
No, not antibiotics. So it uses a peroxide-based solution to keep those pockets clean, eliminate the bacteria, in addition to utilizing the laser. You
said you want to, we talked on the phone, you want to wipe out in Colorado gum disease?
Yes, yes, if I could.
You said I'm a competitive guy. Do
Yes.
you want to wipe it out?
I would. I would love for all my patients to come in, have a quick, short visit, and I don't have to do any work on them because we've gotten rid of gum disease and we've gotten rid of all that bacterial infection.
So when I hear stories of people, Randy, I have bad gums, because they ask me for referrals. I have bad gums. When they refer to bad gums, they're referring to they have an infection.
Yes.
So are you telling me that you have patients that you work with the laser and the gums get nice and healthy?
Absolutely.
Really?
Yes.
And you said also that you see transformations in your practice.
Yes.
That it's more than just gum disease. Mm-hmm. Elaborate on that, what you mean by that.
Well,
where you improve people's lives.
Yes, I had one patient. She came to me after years of not smiling, of not being happy. She came to me already knowing that she had something going on. She said, I know my gums are bad, I know my breath is bad, and I know my smile is not great. Can you help me? And we did the assessment. she did have gum disease along with, the other 50% of Americans. And we were able to treat her with the laser. We take that, go around the mouth, and basically eliminate and zap out all that bacterial infection.
So
and now,
okay, go ahead.
And now she comments to me, I see her every few months now, but she comments to me how she is healthier, that her whole body feels healthier, that she's happier, and she could not be more pleased with the results from the laser.
Good, good, good. Now, things like hot and cold sensitivity,
Yes.
you say could also be related to gum disease.
Yes.
How so? How so?
As the infected gums get worse, they will shrink down, and the teeth will look longer.
What will shrink down?
The gums will shrink down.
Okay.
The gums shrink down, exposing more of the teeth. And so with those teeth exposed, the roots exposed, you'll have increased sensitivity to temperature differences. Hot drinks, cold drinks, ice cream.
Have you ever had that go away right away?
We have. So it is amazing. As soon as we get rid of that disease, we also do some adjusting of how their teeth rub and wear together, how they bite, which also eliminates a lot of that hot and cold sensitivity. That's part of the laser protocol, is making sure that the teeth come together, which then help the gums be healthier as well.
Is there somebody too far gone? Somebody watching this that they're saying, he probably has never seen anything like me.
I would hope that anyone watching this program would say, let me give him a chance. Let me see if the laser is right for me. Because I've had patients come in on second opinions, sometimes even a third opinion, to say, what can you do for me? I don't want to lose this tooth. And there are cases where if the infection is great enough, we can't, save that. But many, many times the teeth have been loose. We treat them with the laser, and 1 week, 2 weeks later, those teeth are strong. The gums are tight around them, and you can go many, many more years without having to lose that tooth.
Are you ever surprised, by the way, with the results?
I am. There are times when I am in the middle of treatment, I see a tooth that is absolutely loose, and I say to myself, I don't know if this is going to last. I don't know. We'll see how it turns out. But time and time again, I see they come back for their aftercare.
So the gums around the tooth kind of grab onto it.
Yes.
And there's some growing back. In dermatology, we've done a lot of shows at this news desk on dermatology. And when you laser the skin, it lays down new collagen. Are you getting like a laying down of new gum tissue?
Yes. We actually get new, what we call connective tissue growth. And that connective tissue connects the gums to the bone and to the teeth, and actually makes those teeth stronger than they were before. It's absolutely amazing, and I'm still blown away by the success and the great outcomes of the laser.
Now, we are out of time, but you say it's more than just getting rid of gum disease.
Yes, absolutely.
Elaborate.
It's a lifestyle. It's, one of the most important things that people see and that people comment about is their smile.
All right.
And when you go for a job interview, you want to have a nice smile. You want your appearance to be great. You don't want that to be something to turn you away. So having a good smile affects not only your job and your well-being, but your social life as well. Most people either know they have bad breath, some people don't. But it does affect dating, does affect the social life,
Good point.
and even happiness within spouses.
Do they tell you that? People say, I can't even be around other people because of my breath?
Yes.
Like, what do they tell you on the consult?
They will tell me, I want to be able to smile again. A lot of times they hide their smile. I want to be able to be outgoing like I used to be, because I am now, aware of my bad breath, my bleeding gums, and I don't want others to see that. And so they withdraw. They don't go out as much as they used to, and they're not as happy. And so with effective treatment, not only does it kill the disease, but it helps you get your life back. You can eat again, you can smile again.
Well, the teeth get strong.
They do.
And so the painful eating goes away.
Yes.
I mean, you have that happen. They tell you that.
Yes, they can eat like they weren't able to before. They're able to eat harder things, eat steak, whereas before they may have been more of a soft food diet.
Now, what do you say to the people? Okay, so if anybody's been told by their general dentist, you need to see the specialist to get surgery for your gum disease, okay?
Mm-hmm.
I have a cousin, situation going on right now. He was told, but I said, I think you need to find somebody with one of these lasers. In fact, I said, I think I know, get a second opinion. Is that your message too? If you've been told you need gum surgery for gum disease, get a second opinion with somebody that has one of these LANAP lasers.
Yes, absolutely. If you've told that you need a tooth pulled because of gum disease, if you have swollen gums, bleeding gums, bad breath, and your dentist has either told you to go see the specialist, the periodontist, I would say come give us a second opinion.
Or find a periodontist with a laser.
Absolutely. Find someone, whether it's me or someone else with a laser, seek that laser treatment out, because I believe that is a lot better treatment option than we've ever had before.
Okay, good. I want to thank you for coming on the show. Very interesting. They can go to your website, find out more. What about consultations with you? Are they free? I'll put you on the spot.
Consultations are free in our office. No charge for a second opinion, no charge for a consultation visit.
Okay, good. I want to thank you.
All right. Thank you very much.
Great info. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online or direct a friend to it, you can visit our website at wellnesshour.com. You could put in Dr. Twiss. That's an easy one. He'll be the only one on there, Dr. Twiss. Or you could put Laser Dentistry Colorado. You'll find him that way. For now, I wish you good health.